I'm Dr. Cynthia Maung. I am a director and founder of Mae Tao Clinic and work with Japan community-based organization. So our clinic have been providing health service, social service, training for health worker and child protection service for the displaced population. And thank you for coming here, and you can have a look what's going on the border and what are the needs and the challenge and concern facing by the health workers and the social worker in Mae Tao.
Hi, I'm Dr. Ong Mint. I'm a volunteer from Australian Volunteers International and providing some services to the clinic here. This is the place where it started in 1989, and there was a wooden building with earthen floor, and there are patients were in small little beds and with saline bottle and so on. And I've witnessed that in 1994. I'm going to show you the child OPD. They see from 70 to 100 a day, depending on the day and also whether the border, the bridge is closed, the border is closed or not. And on immunization day, which is Wednesday and Saturday, they will get about 100 to 200. For waiting for eye treatment.
So this is a waiting room?
Well, no, it's usually a training room, but there's no place to stay, so they have to stay here to wait until the eye surgeons arrive, and so that's why they're here. It's like a festival. There are a lot of people come. At the moment, they're waiting, and they're screening their eye. They're doing the eye screening, and when the surgeons come, and they will get the surgery or and also the glasses and so on there. So that's why they will be they're waiting here. In fact, this is small in number. Sometime it will be, in a day, there will be about 500 people. When the border is open, there will be a lot of people. Her mum is here to get her eye tested, and so she came along with her baby.
The patient come every day, at least about 50 patients, and most of them is coming from Burma. So we have the daily patient is 50, but during the surgery itself, we have to screen about 300 people, and for the surgery it's about 120 in a week. So the surgeons are from UK, and they come here 3 times a year to conduct the surgery. So for us here, we prepare everything like screening and then giving eyeglasses and whatever clinical methods that we have to provide and manage the patient.
The bridge is closed, so there's when the bridge is open, they have about 50 people. Yeah, from between 30 and 50 usually. And this clinic, this acupuncture clinic is open not long ago, no? Yeah, 2009 they moved from the place where you saw in a training room. They have a little small area, they partition it, and then they would giving treatment to patients. About 4,000 patients. They come here because it's a free clinic. Japanese pediatrician, very rare commodity here, and he is really. You're volunteering for how long?
1 year.
1 year, and it's unique thing about the Japanese volunteers are that he's just got married and he just came back to work here.
For his honeymoon, you come here.
No, he met his wife here, and then got married in Japan and came back here to work. His wife is in Japan, and there was another doctor like that. She got married, and a month after that, she was volunteering for a year.
I came here since last September. In outpatient department, we will see from between 13 and 50 or 16 patients in one day. And usually there are 10 or 15 patients in inpatient department. Now I think because of border security program and weather is good, so there are only a few patients.
Is it the usual symptoms with this?
So in this area, mothers sometimes probably are very poor, but so mother has to go just after the delivery. In that case, some other friends of mother or grandmother have to take care of the baby. In that case, they cannot give breast milk, and they give condensed milk, canned milk. It's very poor. It contains very poor nutrition, poor protein, just only sugar and fat. In that case, patient getting fat, looks like fat, but in fact it's not fat, just sweating or edematous.
This sort of puffy cheek is a symptom of
malnutrition.
Because the food was a not nutritious food. This is Dr. Cynthia, and you know who's behind that in the picture. This is kind of a kitchen and a dining area. Usually people come to pick up food, and waiting area, there's no place to house them, so we house them there. Dormitory type thing. In fact, male and female previously was separated. Later on we couldn't. We got too many people, so we all mixed family sort of members. So they get on okay, because we were worried about the mix and so on, but it was okay. That vegetable patch, we use it for feeding the patient and their families, because the patient and families are provided with accommodation and food, because everything is taken care of really for free. They don't have to pay. Food area has been taken care of by co-founder of this clinic called Siama Notu. She's done a wonderful job, because I have seen the food and I've eaten the food, and it is really palatable food, and I don't know how she does it with little money for the patients and their families. So when they are here, they were provided with food, and because patient families they're carers, because they cannot come in once like in the West. They have to come with the whole family has to cross the border or faraway villages they come from.
And the thing about this clinic is that there's no charge. It takes anybody. They can be Korean, Thai, Burmese, and the migrants that are coming across the border.
Including Thais. They can come in here as well.
There's no discrimination, of course. And it is the poorest of the poor in some respects?
Yes, I would say, because they come from faraway villages on this side of Thailand, and also from the other side as well.
So you're going to get children with malnutrition?
Yes.
You're going to get, maybe you might get landmine victims?
Yes.
You may get every range of ailment and disease that migrants, refugees would experience.
Yes, and I'll show you the trauma area in a minute. Yeah. So where they come back from amputation and so on. We don't amputate people here, and we have to refer them to mine victims. We have to refer them to Mae Tao Hospital, for which Mae Tao Clinic has to pay for it. So a certain amount of funds go to that kind of referral. So we have to selectively refer people. But mine victims, we have no choice. You just have to send them straight away. By the way, these victims can be anyone. There's no discrimination against politics or anything whatsoever. This is counseling department where I work, and there are 5 counselors, and they're in interview at the moment. You can take the long shot, not the close shot.
And what do you, is it trauma? What type of emotional?
It varies from anxiety, depression, alcoholism, domestic violence, all these to do with the displacement. Also, we also have severe psychiatric problem as well, for which we provide medication. Child Recreation Center, funded by Women's Guild from UN Women's Guild from Vienna. It is for children from child IBD, and also the parents who are getting treatment from here. They can't come on their own. They have to bring the whole family. So they bring their children and family, because we can't admit any patient without carer. That means that the relatives who have to come here. And so children have nowhere to play, so this is the place where they can come and play. And also, if the children are traumatized, Darina is a play therapist. She's going to help them overcome this trauma and things like that. So that's the purpose of it. So, and this is newly open, just open last Monday, I think.
This is the Child Recreation Centre. It is a brand new project here at Mae Tao Clinic. It is open a week now today, and currently it is open to children from the IPD and also children from the patient house, which is basically children of people who may actually be in patients here in Mae Tao Clinic. And it is basically a place for them to come and to play and to have fun and to basically just to express themselves. We've got lots of toys, we've got art equipment, and we've got musical equipment. I come from a background in play therapy, and my idea for the centre is to provide psychosocial activities for the children, and the staff are really excited about that too, and are really keen to learn new activities and to be really trained in this. And as you can see, it's a really great success so far, and all the children really enjoy coming here. We are also going to have an outdoor playground and sand pit. That's something in construction at the moment, so that even when the centre isn't open, the children can go there and play as well. Very often you find that children around here don't get that much opportunity to play, and especially to actually play with toys. And children express themselves and let off steam by playing, and that is basically what the centre is going to be here for. All children, I think you can pretty much assume that they have experienced some kind of trauma, whether it be just simply leaving their friends and their family back at home, or actually having to flee during actually an experience of violence. So most children will have experienced trauma who come here. And you see that in their play as well. You'll find a lot of children, some children don't even know how to play. That's one thing that I've observed. And then also children, they don't know how to play with each other. They're not too sure what to do with these things. Some children are a little bit more aggressive than others, some children are more withdrawn than others, and that's all signs that children need psychosocial help, and they need opportunities like this to actually play, and that's because that's how children, that's the best type of therapy for children, is through play.